everyone, I'm Nikki. I'm the registered nurse here at the Freedom Clinic in Toronto, owned and run by John and Kelly Rainey. I've been working here now for 7 to 8 years, doing primarily platelet-rich plasma for hair loss. I've seen many clients have successful treatments, and what we're now able to offer is a more advanced platelet-rich plasma treatment by using autologous exosomes. Now, exosomes are signaling vesicles that are derived from stem cells. And what they do is they communicate between the cells, telling them to release more growth factors, cytokines, and proteins to stimulate dormant or weakened hair follicles. So this way, it's like the next level beyond PRP. And the fact that it's autologous exosomes, that means it's coming from you. It's your own blood source. It's not animal derived or plant derived. It's your own exosomes. So it's extremely safe. So here we have the exosome sort of process. So we're using these Cellarich Exosomes. And what I'm going to do is I'm going to extract blood from you, and we are going to spin it in this machine here. And then I'll extract the exosomes and we're going to spin it again. And that way we will have the autologous exosomes that I can add to the treatment of platelet-rich plasma. Treatment involves 4 sessions, spaced about 3 to 5 weeks apart, ideally. Ideally 4 weeks, I guess. And then what you're going to do is you're going to come in and you're going to meet with John, our trichologist, and he's going to go through a whole process of examining your hair and establish where you're at and what your options are. One of your options is going to be doing PRP with exosomes. And each session, the first 3 sessions, we use the exosomes, and then the 4th session we do a sort of flooding of the PRP. We give a very large amount of PRP to sort of really fertilize and boost the 3 sessions that you've already had. And we're the only ones in Toronto offering this service right now. When you're doing your research into exosomes, it's very important that you understand what autologous exosomes are. The word autologous is key because it is from your own blood and it can be injected. Any of the other exosomes, animal-based or plant-based, cannot be injected. It is not Health Canada approved, whereas autologous exosomes are Health Canada approved. So just remind you when you're doing your research, you want to be looking up autologous exosomes.